Rob, it looks like you got the short chair. Do you want to let
It's not
color one or are you okay?
I didn't want you to go anymore.
All right. Wish I was half as thoughtful as you.
The regular meeting of the Grand Traverse County Public Health and Safety Committee to order for Wednesday, May 4th. We'll start with the Pledge of Allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Sam, would you call the roll, please?
Commissioner Fleece,
Present.
Gilman,
Here.
Henschel,
Here.
Inman,
Here.
Lemkool,
Here.
Max Bauer,
Here.
Richardson,
Here.
Thomas,
Yep.
Chairman Wheelock.
Yes, ma'am. We're all here. We have, first order of business is the approval of the April 6th minutes that were in your packet.
Move for approval as presented.
Support.
Motion by Inman, supported by Thomas. Further discussion? All those in favor say aye.
Aye.
All opposed, the same. Motion carried. This brings us to the first opportunity for public comment. Sam, if you'd read the rules, please.
Any person shall be permitted to address a meeting of the Board of Commissioners which is required to be open to the public under the provision of the Michigan Open Meetings Act as amended. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board shall state his or her name and address. No person shall be allowed to speak more than once in the same matter, excluding time needed to answer commissioners' questions. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. Chairperson may, at his or her discretion, extend the amount of time any person is allowed to speak.
Having heard the rules, is there anyone wishing to make public comment at this time? Georgia?
Good evening. As part of my report, I have an item in there for Public Health and Safety Committee called Home Chore Equipment Purchases for 2011, and I would like to pull that out of my report and bring it back at a later time. We're not ready to discuss that yet, so I still have some work to do. So I'd like to pull that out of my report.
Okay. Okay, that will be noted.
Thank you.
Anyone else wishing to make public comment at this time?
Jim Pasco, I'm Vice Chair of the Commission on Aging Board, and one of the items for discussion this evening is addition of a Deputy Director for the Commission on Aging. At this point, we're all aware that the Commission on Aging has taken on quite a bit of additional responsibility, setting up regional senior centers, as well as taking over operation of the Traverse City Senior Center, for which there was a lot of hard effort done to get a millage passed to support that activity. I think it's very important also to realize that 4 or 5 years down the road, we are going to be well above probably 20%, 21% in terms of seniors in Grand Traverse County. This is the premier place in the state, it seems, for people to want to retire to. And I'm speaking here on behalf of myself and the Commission on Aging, asking for support for the position of Deputy Director. The time has come. The time will not go away. There's a tremendous amount of responsibility on the hands of the Director, And we are so busy now that when the director goes on vacation, or if the director is ill, or if the director has other responsibilities as given by her supervisor, we are not in a position of taking responsibilities that should be done today and putting them off to tomorrow because we have lack of staff and lack of someone to step in and take that responsibility. I ask for, on behalf of the Commission on Aging, for all of your support for the position of Deputy Director, and thank you for the opportunity to speak. Are there any questions? Thank you.
Thanks, Jim.
Thanks, Jim.
Anyone else?
Good evening. My name is Shawn Burt. I'm also on the Board of Directors for the Commission on Aging, and I live at 4415 Bartlett Road in Williamsburg. And I also wanted to just address you and ask for your support for the Deputy Director position. There is a tremendously growing population of seniors in our county, as Jim just mentioned. The need for service is growing exponentially, and there are no extra office staff in that office, so they're already stretched thin. And it would really be an excellent idea to add a deputy director at this point. That individual could not only help with the oversight of the office, but work with Georgia, learn the operations, provide additional management oversight for staff, for the budgeting processes, you know, all of those very vital roles that are very essential. And it's an excellent time for someone to be mentored under her. So we would ask your support. The board is definitely in support of adding this position. Thank you.
Additional comments? Seeing none, we'll move on with the agenda. There is a second public comment toward the end of the meeting. The next order of business would be the approval of the agenda.
I move for approval as presented in the amended agenda to us.
Support.
Motion by Richardson, supported by Fleece. Further discussion? Those in favor say aye.
Aye.
Opposed, the same. Motion carries. No special order of businesses, Dennis? No. The consent calendar, Sam, would you read the consent calendar, please?
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed therefrom and placed elsewhere on the agenda for full discussion. Such request will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file, or approval is approved by a single committee action adopting the consent calendar. Receive and file Community Corrections monthly reports for March, Commission on Aging monthly report, Community Collaborative Coordinators report, Veteran Services monthly activity and minutes. Approval, Animal Rescue Organization agreement with Cherryland Humane Society, home chore equipment purchases for 2011.
Any item that the audience wishes to have pulled first? Georgia wants the home chore equipment purchase pulled.
But that's pulled and deferred to another meeting.
Pulled and deferred, yeah. Anyone else in the audience? Seeing none, any board members? Chris?
No, I was just going to make a motion.
Okay.
I would move for approval of the consent calendar as amended.
Support.
Motion by Max Barr, supported by Fleece. Further discussion, Rob?
Yes, please. Just for some clarification, who puts together our consent calendars?
I do with Chris Kramer, and depending on the committee, it's with consultation with the chairman of the committee.
Okay. It seems like every time we purchase equipment that it comes up on the consent calendar when we know Commissioner Fleece is going to say he abstains because we're buying it from him. I was just going to suggest let's skip that in the future and just go ahead and put it as an agenda item.
That's a good idea.
Save us some
Okay.
time.
Yeah, that's a good idea. Okay. Any further discussion? All those in favor say aye. Aye. Opposed, the same? Oh, I'm sorry. Roll call vote. I know better.
Commissioner Gilman,
Yes.
Henschel,
Yes.
Inman,
Yes.
Lemkool.
Yes.
Max Bauer,
Yes.
Richardson,
Yes.
Thomas.
Yep.
Chairman Wheelock?
Yes, ma'am.
Please.
Yes.
Motion carried. Department action items. The first action item is a facilities management truck, page 49 in your packet.
Motion to approve.
Support.
I guess the only point, I have a motion by Limcool, supported by Fleece. The only comment that I have to make is that I will be abstaining from this vote. As you probably noticed in your packet, I bid the repair on this vehicle and will be contracted to do the work. So, is there any further questions, comments?
Thanks for giving us such a good deal.
Well, it's nice to be
You already did-
complicated when you do it every day.
You already did it?
No.
We used to
Please don't go there.
And I still call you.
before we had to do all this
Okay.
stuff. It was always
Commissioner
just done.
Henschel,
Yes.
Inman,
Yes.
Lemkool.
Yes.
Max Bauer,
Yes.
Richardson,
Yes.
Thomas,
Yes.
Chairman Wheelock,
Abstain, please.
Fleece,
Yes.
Gilman.
Yes.
Moving forward. Health Department, update on NACO prescription costs.
Cards.
Cards.
Cards. Costs.
Okay.
Good evening. I am Sarah Ray with the Grand Traverse County Health Department. I'm the new Community Outreach Coordinator. Prepared for you a general summary of some data on our prescription discount plan that we have been providing to residents through NACO. The data is compiled from September through March. And you can see on the chart there's a brief description of each category. Basically what it's summing up for us is how many people are using the card, how many prescriptions they've filled using the card, their average savings, and the retail priced and the plan priced is a little complicated, but basically what we're finding are that the people are coming in with the cards and the pharmacy is saying, well, instead of using your card to get a discount, we can offer you a better price. And NACO is tracking that for us so we can stay up to date on that. So if you want to see that graphically on the second page. Basically what I've done since coming to the health department in January, I've made sure that the cards are available at every single county building as well as every single school in the front office. I've also made sure that the information on our website has been up to date and all the pharmacies are still participating and accepting the cards and keeping that information on our website up to date. I just recently compiled a graphical or a map of which pharmacies in the county. So if you go on the Grand Traverse County website, it says prescription discount plans. You can click on a link and pull up a Google map of exactly which pharmacies are accepting the card. In the next coming months, NACO provided us 1,200 mailing-free slips that have the card attached to it, and those are going to be going out with various bills that we're sending out of the Department of Public Works for clients who maybe haven't seen the cards in the community yet. So it has all the information on the slip, and like I said, NACO provided those to us for free. So I just wanted to update you on the trends. It basically looks like each month the number of prescriptions is consistently rising as well as utilizers. It's gone from 14 people in September when it was enrolled, and now in March we had 33 people who utilized the card to cash in on 60 prescriptions. So we see good growth in it, and I think it's going to continue to really benefit our residents. So, any questions I can answer for you or clarify? Yes?
Yeah, I do. If the county could go into a self-funded prescription program and use these, could we save money? Has that ever been explored, Dennis?
You mean employees?
Yeah, for employees. If we self-funded our prescription drugs and used the NACO discount card, could we save money?
We have looked at self-funding our prescriptions, but I don't know that, since this is only 6 months old, I don't know that we've done a comparative of using the NACO cards, but we will. When we bid out, you'll recall that when we bid out the health insurance for this next year, we're both asking for premium-based plans and self-funded plans, which would include prescriptions. So we can take that into account, and we'll make sure and evaluate that when we look at it.
Okay.
Interesting.
Some examples that have come out, like, for example, for Tuscola County, when we met with them down at MAC conference, is that they have these cards in the library, all the townships, the villages, you know, city offices, those kinds of things, and it's really worked out well in terms of penetration out to the community. But, you know, we haven't, somebody brought up the idea about, I think it was Christine Maxbauer, brought up the idea about putting them in the townships at our last meeting. And
Yep.
I don't know if you just want to give us a supply and we can deliver them, or you want to take the initiative.
I've been working to verify that they are available in areas like that. That was something that was brought to my attention last month, so
Okay.
I've been working my way down the list.
Okay.
Another portion of it, too, is providing, where the cards are available, providing the people there with information, because I think there was some misinformation. People weren't aware that this card is for anybody, regardless of your
Right.
income or age or insurance coverage. So I put together some nice FAQ posters that could be on display next to the cards, so that I think in the last couple months has really helped educate the residents when they're picking up their cards, so that they know it's not limited for people under a certain income level. So.
Okay, great.
Any other questions for Sarah?
Well, thanks.
Thank you very much.
Thank you.
Keep us posted. Next comes the TART reallocation of maintenance funds.
Hi, thanks. I'm Julie Clark, the Executive Director of TART Trails. In your packets, you should have received the letter outlining the request. Tonight, I'm just here to officially request it, I suppose, and answer any questions you might have. The opportunity arose when I learned from the city that DTE was going to be putting in a gas line and taking up, it's going to go right underneath the trail just west of Elmwood. If you've been out on Grandview, you've probably seen the disruption out there. So working with the city and DTE and Elmer's, we tried to put together a potential cost to replace the trail. The trail's over 10 years old. It was an 8-foot wide trail when it was installed. Certainly, you all are very familiar with how active that area gets. We did some counts a couple of years ago, and we know that there are several 100,000 that use the entire trail system, and I'd be willing to wager that we get a significant chunk of those users on this section of trail. The idea is we can use this opportunity to get the best pricing. We got a quote from Elmer's, and since they were out there and already mobilized, it was a pretty good deal after having checked it with a local engineering firm in the city itself. So we're all hoping that if we chip in, we can replace the trail. Like I said, it's old, and it's also much more narrow than it needs to be there with all the use it gets. So if we can put the money that's typically allocated to TART projects, that was the other good thing that occurred, is TART received a grant from Home Depot to pay for the materials for the bridge redecking. So instead of using that money on bridge redecking, which we've typically done in the past couple of years, we'd like to see it reallocated for this project. We think it's a pretty good collaboration and it will result in a good trail.
Motion to approve.
Support.
Motion by Lemko, supported by Richardson. Further discussion? Rob?
Just curious, how much money will TART save by doing this project now versus if they were to just do the whole thing on their own?
Oh, $60,000 some dollars. I mean, that's the cost. So that's not the savings, but that's what it would cost
Okay.
Well, certainly,
Well, and
you'd save
more.
the $30,000 for sure
Yep.
from Mishcon.
from Michigan.
That's a one-time grant to do that.
And we know
now.
Elmer's, they were very generous because they said they were already out there and mobilized. So I'm not really sure, but a chunk of change for sure.
Yeah.
This is coming from, was this budgeted, or is it just coming from the?
This is budgeted.
This is
We
budgeted.
budget $10,000 a year for maintenance
Okay.
of the trail, which was our commitment.
Okay.
And since they were able to get grants for replacing the bridge, it frees that $10,000 up, and they're
Gotcha.
asking to switch purpose.
Okay, all right, good. Ross?
And, you know, if I could just point out that, you know, this is a maintenance project, and we're getting to the point now where the trail system is old enough and well-used enough that, you know, we're going to have to put some more money back into these trails. But obviously, they're a huge draw and, very popular with the public and also very popular with, I think, out-of-town visitors who come here. It's one of the reasons people like to come to Traverse City is, our great trail system.
How are you doing on your fundraiser for the finish of the Leelanau Trail?
We kick it off tomorrow night, so I don't know yet. Pretty good with pledges in so far without having done anything. He's referring to, there's a gap in the Leelanau Trail, a 6.6-mile gap where it's two-track, essentially. It's not paved, not really improved. And we received a transportation enhancement grant. Well, didn't receive it. It was, conditional commitment letter. But we hope to get it awarded in October. Our match, we're raising match dollars as well as additional dollars so we can pave that entire section and be done with it and finish the trail, actually all the way to Dumas Road. So we're pretty excited about that. You'll be hearing lots from us as we try to raise the funds.
So anybody wants to make a donation, please do so.
Anytime, of course. But I really appreciate, everything you do for the TART Trail system, and I hope that, the benefits that it provides the community, you guys see, and I'm happy to keep coming back to report what a great job y'all are doing and what great use it gets.
Larry?
Have you ever done any studies on usage per month?
We do counts, and we do 2 times a year, we do a count. And we also did a study in 2002, I believe. The Michigan State University, we commissioned them to do a study. We're working with MITGA, which is the Michigan Trails and Greenway Alliance, to do a study, economic impact study of trails in Michigan. We are hoping that the TART system will be part of that study. So it's been a while since we've done a really full-focused study on trails, but we have in the past, and we're looking to do it again in the near future.
You said you do it twice a year?
We do counts
What
twice
months
a
are
year.
those?
May and September. It all feeds into a national count that's done in May and September, so we're feeding a much larger database, and that's something we'd also like to take a look at, because we haven't really extrapolated that data, and it's something we're hoping to tackle this year.
Further discussion? We have a motion on the floor and seconded. All in favor, say aye.
Aye.
Opposed, the same. Motion carries.
Thank you.
Thank you. Next item is the staffing amendment request by the Commission on Aging. This item was added to your agenda tonight and is in the amended agenda packet that you have before you.
Mr. Chairman,
Yes, ma'am.
I would move to amend the staffing plan for the Commission on Aging Department with the addition of 1 FTE Deputy Director effective June 1st, 2011.
Second that?
We have a motion made by Max Barr, supported by Gilman. Rob?
How's this fit in the budget? Or, I'm sorry, is this next year or this year?
It's this year.
This year.
This year.
This
And-
is of course, the Commission on Aging is,
Always funded by millage.
guys, look, one of you looks so
Oddly.
tall, and the other so short.
George just stands up, it'll be fine.
I'm sorry.
I'm the same way when I stand up.
Remember that the Commission on Aging is funded by a millage with a charge from the public to provide services. This has been evaluated in terms of their current budget by both the Commission on Aging and our staff. It's been evaluated in terms of the current budget as well as the changes that we made last month with the clerical positions outreach positions. And so that's a long way of answering. There is money there to cover that. It's been projected out for the full life of the millage, and there's money there to cover it out of the millage funds for the full life of the millage. So, and they have a substantial fund balance as well. So there's money clearly to cover it, and this is a position that Jen and I have evaluated long with Georgia, and we believe that there's a significant need. What we've had in that department excuse me, is a great deal of growth, both in programs, but also in the existing programs, home chore, everything all the way to foot care. And what we haven't done is done anything to bolster up the administrative staff to manage the growth in employees. And Georgia, I don't know, in the last 10 years, what would you say, how many employees have you grown, would you guess?
At least 20.
Yeah.
In the last
And the
5
management
years,
staff
probably.
has not changed at all. So it actually, they originally looked at an office manager position, but frankly, it was Jen and I who evaluated it and felt that the more appropriate way to deal with this is to have an assistant director, someone that can help Georgia with the administrative needs. This is particularly, the thing that really took it over the top for me was taking in the new senior center and making that part of the county program and evaluating outreach to the rest of the community. And we felt that that needed some special attention by Georgia, and allowing this deputy director position to take care of kind of the ministerial duties of the main part of the office will free up her time to work with Lori and continue to develop those programs. So we think it's very warranted.
My question was, how does this fit into the budget?
No county funds will be used.
I'm sorry?
No county general
Well,
fund
I
dollars
know it's a
will be used.
millage, and I know you also set a budget at the beginning of the year.
Right.
And was this in your staffing budget, or are you
No.
adjusting services to accommodate the staffing?
We are
No.
going to have to amend the budget to
Yeah.
accommodate this position.
Okay, and
But we
what,
won't adjust service, the service
Okay.
level will stay the same.
okay, I'm just asking, what did you cut out so you could put this in, because you had your money budgeted?
There was nothing cut out.
Nothing.
It will come out of the fund balance and the additional millage that's raised.
Okay.
What your fund balance, Georgia, was? I know you don't like to talk about it.
It was about 1.6 million, and now it's probably, after last year, I think it dropped a couple hundred thousand.
Yeah.
I think it's about 1.4
So this is in
now.
addition to the budget. Nothing is being reduced.
So this is going to be paid out of fund balance for the remainder of this year, and then next year it'll be in part of the budget?
Yes, and we also got $165,000 back from delinquent taxes this year, so that will more than cover a couple of those types. So we're not getting two, but it would cover, it will more than cover that position for a couple of years.
Thank you.
Chris?
I wanted to mention that one of the benefits of creating this position, and I will say that the Commission on Aging Board has been well aware for a long time that staff has been stretched right to the max over at Commission on Aging, and they just basically sit and answer phones and try to put out fires and serve clients, and they've needed some help for a great deal of time. And when I spoke with Dennis about this, he and I talked about one of the benefits of doing a deputy director is Georgia is now going to have the senior center with Lori Wells as a deputy director under her. This will allow cross-training between those two positions. And as Dennis mentioned, there are, 18 programs that we have now under Commission on Aging? There are 18. We just ranked them yesterday.
Yeah.
And clearly, the help is needed. And I really think this is going to immensely improve services for clients in Grand Traverse County.
Ross?
Is it fair to say that we're getting this because of the addition of the senior center to the?
I'd say that's part of the reason. The other part is that we've added so many clients, so many services, so many employees that we can't manage it anymore. It's just not manageable.
Because I have two issues with that. One is that this didn't come up in budget discussions last fall, and over the year and a half where we were talking about the senior center and having meetings about the senior center, there was never any discussion about having to add administrative staff to the Commission on Aging to handle the needs of the senior center. Now, obviously, we've added staff to the senior center because we're covering a larger area than they were before, but there's just never any hint that there wasn't enough administrative staff in the Commission on Aging to, handle the senior center duties.
Well, Commissioner, I may have confused you by the way I presented that. What I was trying to say was that these responsibilities will be reallocated in a different way, and Georgia will take over primary responsibility to focus on the development of the senior center and the senior center programs. The other administrative work to run home chore, health aid, all the other programs will be overseen by this deputy director. In terms of the need, if we didn't have the senior center, I would still be here telling you we should have a deputy director because we've increased this department by 20 employees and it's not manageable by one director. But she will focus I wanted to make sure she had time to focus on the senior center.
Okay, I just don't understand that if we had a senior center director who was still the senior center director, why it was necessary to then hire another person so that somebody could oversee the senior center director. I mean, at a time when the whole county is being faced with, not exactly a budget crisis, but certainly, budget concerns. And there's been discussion about layoffs. I just don't see why we would, hire a whole new position, and that's all.
Well, I think I could tell you, the reason that this wasn't more timely in terms of the budget, we've been dealing with personnel issues in the Commission on Aging Department for the last year and a half, trying to determine and make a decision on whether this was issues of the employees or issues of our ability to manage them appropriately. And we went through several renditions of this, and it was just recently that the final outcome we came up with was this need for a position that was managerial to help assist dealing with the personnel issues. So the timing of it, we understand, was not perfect. It would have been better to handle it in the budget, but I have enough concerns about the implementation of this program, and that's not any kind of a comment on Lori Wells's ability or anything like that. It's simply a comment that one of the things I heard consistently from commissioners was, please make sure that the outreach programs expand appropriately into the rest of the community so that the whole community sees the value of this senior center millage. And that's something that I think I've charged Georgia with as staff, and I expect that she's going to pay special attention to that along with Lori. So, I think this position would have been needed, and I'd ask Jen to comment on it. Jen, what your thoughts are on it as well?
Yeah, I absolutely think it's necessary. And just to clarify too, Russ, the structure of the organization that I've recommended and talked with Georgia, and she agrees, is that the 2 deputy directors, so this new person and then Lori, would report to Georgia. So the new deputy director, Lori will not report to that. I just want to make sure that's clear. So you're basically looking at Commission on Aging kind of with 2 branches. You got your Commission on Aging servicing everything we're doing now with the foot care and PERS and all that, and then you got your senior center branch. Both would have a deputy director that would report to Georgia. So I just want to clarify that. But yes, absolutely. I think that there's a lot of Georgia, I did a time study with her and job shadowed her for quite a while, and looking at her time, she has a board that's very engaged, and that's a good thing, and I think that they need a lot more of her time. And there's a lot of projects and more strategic things that Georgia could really be focusing on, and I think having this person will free up her time to be able to do some of those things and implement the senior center and continue growing the Commission on Aging.
Jason?
So, and in the future, you're also looking at, if I'm not mistaken, I've overheard some conversations, you're looking at eliminating some duplication of services. So for going forward to future budgets, you're going to be, this might help you find those by having a person who can maybe oversee some of those things, so you're not pulling your hair out trying to keep up with everything?
Well, actually, Lori and I have already identified a few things that we think, now that we're merging, both of us don't have to be at certain things, only one group has to be there, so there will be some cost savings there and time savings. But really, what I see most valuable for the deputy director is taking over the operations of the Commission on Aging, because we've gone from one clerk and a supervisor to 2 supervisors and nurses and 2 clerks and 2 office specialists and plus a board. It's just not manageable for one person, and we'll soon have 45 employees. It's just gotten kind of crazy. We did ask for, when Siegel first started, I think I had approached HR about looking at an office manager, and we were turned down. So then we came back a couple of years later and asked for an office manager, and we looked at different options. We looked at office manager, we looked at office coordinator, we looked at deputy director, we looked at a lot of different options, and ruled out all other options because of certain things. They couldn't do certain things, they didn't have authority to make decisions, they couldn't supervise people. So we ended up, after probably a year of talking about it and requesting it at least 3 years ago, it was probably right when Siegel first started, and we kept being told, wait till Siegel's done, wait till Siegel's done, and we're going to look at your whole department. And Siegel's been done, and we've grown, and we're still growing, and we're just at a point where it's not manageable.
Herb?
Yeah, what about space requirements?
Are you running out of space when you're adding all these people, and what is your future plans for looking at where you're going to put everybody? Or are you going to start stacking them in like cordwood?
We talked about remodeling before we talked about this position, but we did include a person in our remodeling talk because we are limited on space, and there's a couple reasons. Not only is it because of more employees, but we've started a loan closet some years ago because we found a community need for that.
I sent somebody there
And-
today.
Yeah, people are in and out of our office all the time for that, and storage is an issue, and the only storage we have is at a sub-level, it's not handicap accessible. There's a whole lot of things that we are working on right now with, and MSU has agreed to give us some space on a handicap accessible level, so that's worked out, but, so we're looking at redesigning our office. I think we have some wasted space, and I think we have some people in offices that don't need to be in offices, and other people, you know, we just need to juggle some space around, maybe put some workstations in there and use up some of our space better.
Just because you're adding people, that doesn't mean that you're not going to also add some more costs in order to be able to find places for these people. And that's
Right.
one thing I wanted to bring out, because we already are looking at that at the health department as to what are we going to do. And now we got a department that's exploding, and you're still in the same space.
Yeah. We'll I mean, there will be other costs. There'll be a computer, there'll be some kind of workstation, software that goes with the computer, supplies, but I think we'll be more efficient by adding another person than we are right now.
And you have enough, correct me if I'm wrong, Georgia, you have enough space right now in your current layout to
Add
add
a
this
person.
person.
It'll be tight, but
It'll be tight, but you don't even, you can add the person now, but, yeah.
we won't be moving. The plan, part of our plan was when the senior center builds their new building, the design includes a space for the Commission on Aging, and Dennis and I have talked about that, and we would hopefully co-locate with them at some point in the future and have our operations all together, which would be wonderful and better to manage. So that was part of our plan, too.
Jason?
And you initially talked about some cross-training and some cross-responsibilities. Would Lori's position then be brought out from just that? And then, I mean, would there be a use of both of them at the senior center? And then with the other responsibilities?
If Lori was out for a week with the flu, the other deputy director could go over and help fill in, and vice versa. And we're doing that with all of our positions. We're cross-training too, so if one person's gone, the other person can fill in. Because sometimes, for instance, we have a billing person. If the billing person is gone and the person isn't cross-trained, we can't do billing because only one person knows it. So we have all the procedures, but procedures, you know, they're kind of shaky sometimes. So we're cross-training everyone, and the the deputy director and Lori's position would be cross-trained.
Larry?
You know, of all the county departments, I think you run a real well organized department. I think it speaks to that when you have your vice chair and another board member here, and the board supports the deputy director. When you get Jen to agree, you get Dennis to agree, I'm absolutely in favor of this motion because I would love to see the Commission on Aging continue to do all you've done in the past and maybe more in the future. It's one department I never hear a complaint on. All I hear is accolades. Thank you.
Good. Thank you.
Chris?
Well, I just wanted to tell everyone that I don't spend money lightly, and I went over one morning when Georgia was on vacation, and I took my computer in, and the staff was wondering why I was in the conference room, and I said, well, you know, I need to work, and Georgia said I could use the conference room for a little peace and quiet, and I sat there, and I didn't do much on my computer, but what I did do is I sat and I listened to what staff was doing. And I have to tell you, this position is absolutely necessary. And I think that the clients of Grand Traverse County, the senior clients that we service, are going to be extremely grateful. And I think you will see exactly what Commissioner Gilman mentioned, you know, more efficiency. And we are at the Commission on Aging in the process of taking a look at all of our programs and trying to make them more efficient, and we are trying to prioritize We are looking at, for instance, the 911 phones that we have provided for seniors in the past. We're saying, you know what? That service is being provided by other organizations in the county, and we have limited resources. We don't need to be doing that. All we need to do is be able to tell our clients when they call, this is how you get 911 phones. So we are trying to be more efficient. I think you're going to see improved efficiency if you approve this.
Any further comments? We have a motion made and seconded. All those in favor say aye.
Aye.
Opposed, the same?
Aye.
Roll call, please.
Commissioner Inman,
Yes.
Lemkel,
Yes.
Max Bauer,
Yes.
Richardson,
No.
Thomas,
Yes.
Chairman Wheelock,
Yes.
Lees,
Yes.
Gilman,
Yes.
Henschel.
Yes.
Motion carries.
Thank you. Thank you.
Thanks, Drew.
That will bring us to MSU Extension. Good evening, Pat.
Good evening. I'm Patrick Cudney. I'm the District Coordinator with Michigan State University Extension. First order of business this evening is to introduce our new 4-H Program Coordinator for Grand Traverse County. This is Roxanne Johnson, and I'll turn it over to Roxanne.
Hi. Good evening, and thank you for inviting me tonight. I was asked to introduce myself and share a few details about where we kind of see 4-H programming going in the county. A little bit about me: I was practically born into the 4-H program. When I was very young, my mom was a leader, and I grew up watching all the older siblings and the neighbors in the program. And once I was eligible, I joined, and they had to kick me out when I aged out. I loved the program so much that I was a team leader. I went to MSU Exploration Days, and I even did my college internship with Isabella County MSU Extension. I've always been one of the best advocates for the program. I know firsthand what it can do for a child, and I've always appreciated that and encouraged people to get involved. A bit about my professional background. For the past 10 years, I've been working in youth development. I started with at-risk youth in Mid-Michigan Community Action Agency, and then I was with Girl Scouts for 8 years before starting this position on April 1st of this year. So I'm relatively new in the county. I have a great deal of program development and facilitation, though, most recently focusing on science and technology, engineering, and math. You hear the STEM acronym quite often within schools, and kind of encouraging and describing the importance of that programming. So as far as Grand Traverse County, my focus is really going to be on club development and club management. I want to strengthen the clubs that are already there and share new resources with them, but then also kind of bring it into what is current with 4-H. Science is a huge thing right now, and we have some really cool resources, everything from aerospace to robotics. They can do photography. I mean, there's so many programs that are out there that people aren't aware of. So hopefully, with kind of my push and my encouragement and some recruitment skills, I'll be able to get some new leaders in the program. And the ultimate goal really is I want to see the 4-H program be the program that are building the youth for tomorrow. So do we have any questions?
Anyone have any questions for Roxanne? Rob?
I'm sorry, is there any more to your presentation?
Oh, yes. This was just my little intro, and then I'm going to turn it over to Mr. Cudney, and he's going to go into the memorandum for you. Okay.
Well, I think the one thing that we, for those of us that have been involved a little while, the 4-H program in Grand Traverse County is still very strong and very vibrant.
Very.
When the Northwestern Michigan Fair comes, go out and see the animals, see the livestock. The barns are being rebuilt. We have a new pig barn this year, which everyone's real excited about.
Absolutely.
And, we'll see more animals. We probably will have more animals at the fair this year than we did when Grand Traverse County was in its height of agricultural livestock.
Absolutely.
We just have more kids involved.
Animal science is always going to be, kind of the base of it. And it's such an important skill for these kids to go through. And the things they learn from raising that animal and actually going through the program is huge. Right now, we have, there's over 650 youth that are involved in 39 different clubs, individual clubs. A lot of kids are in multiple clubs, so, they'll be in different, but it's 650 youth and over 150 volunteers, so we definitely have a very strong program here.
Chris?
What I have a problem with is this is a club. Much like Girl Scouts is a club, Boy Scouts is a club, why should the county subsidize you and not Girl Scouts and not Boy Scouts and various other clubs?
Yeah, well, and I think that's really kind of part, we'll go into the memorandum a little bit. The one thing with 4-H that is unique from Boy Scouts and Girl Scouts is that it's all-inclusive. It's boys and girls cooperating, working together, and it's very family-friendly.
So, the Boys and Girls Club is a boys and girls club. And hockey, boys and girls. I view this as a club, much like other organizations, and I need to hear a reason why I should fund this and not them.
Sure.
Yeah, I think if it's all right with the board, I think these are probably questions that are more appropriate to Pat than they are to Roxanne. This was really a chance to introduce Roxanne to you.
I'm sorry.
And you have gotten an introduction.
You bring up good questions.
I just wanted to make the point before Roxanne left that, 4-H livestock is still very strong. Jason, did you have a question?
The only, and actually, on your comment there, when you're talking about expanding the scope, you're talking about other things within this club, other things we're doing.
Absolutely.
Let's assume, and again, are we asking the right person? But let's assume that you have a limited amount of funding for what you do.
Sure.
Does the inclusion of those other things, does that cut into what I've always viewed as a 4-H more in line with straight agriculture, animals, animal husbandry, basically raising the animals and livestock?
No. The goal of the program, and it's always going to be, is to offer everything. The uniqueness of the program is that each club decides, what are these kids interested in? The children are in charge. They take the leadership role. They decide what it is that they do. And it truly is about their development and what it is that the kids want. There's going to be kids in clubs where they're doing animal science, but maybe they also want to build a rocket. And we want to offer them that curriculum, that encouragement. The one nice thing about Grand Traverse County is we have all the curriculum and the resources. We make that commitment to have them there, so there's no cost to the kids to actually get a hold of that stuff.
Great questions, and I'm glad to help expand on some of those answers. The opportunity tonight was to introduce Roxanne to you, and she's grown up in the program, been a leader in the program, and just learning some of the really essential elements of the program as a staff member. I think what makes 4-H unique across the nation is it's a three-way partnership between federal government, the state land-grant university, and county government. What is the shining star about 4-H youth development is it's a research-based program. We can show direct correlation between children who participate in the 4-H youth development program and their success and as an adult later in life. We have the statistics to show that, how many go on to higher education, how many go on to become productive members of society. And we can provide those for you on a statewide comparison compared to youth that are not involved in the program. To answer your question about why fund 4-H and not fund Boy Scouts and Girl Scouts, and Roxanne did an admirable job about beginning to answer that question, is because it is not an exclusive club. It is open to all youth, irregardless of sex, irregardless of whatever other barriers those organizations may put, and they're excellent organizations. I'm not going to critique their organizations, but 4-H youth development program is an opportunity to be involved in research-based curriculum and education for youth across America. It's the largest youth-serving organization in the nation, by far, bar none. We have a proud and strong program here in Grand Traverse County. The project is the child. The projects that the children work in is what gets the children interested in being part of 4-H. The traditional livestock and horse clubs, as animal science, as Roxanne said, is a very, very important part of what we do, but it's not all that 4-H is. It's what 4-H gets very much recognized and gets a lot of press, and it's a large amount of youth that are involved with that. But we're also involved in the schools, in science, engineering, technology curriculums that Roxanne stated. We're involved in jump into food and fitness programs with local schools. There's lots that 4-H youth development is involved in that you might not recognize because it's not a traditional livestock or horse club. So I hope that helps answer some of your questions.
So the only other question I had is, do they have to pay a fee in order to become members of the 4-H to the 4-H?
There's a $10 annual enrollment fee for every child in 4-H. There's local fundraising that the volunteers do to offset those costs, so no children are prohibited from participating in 4-H. $5 goes to Michigan State University, not for staff, not for benefits. It goes to Michigan State University for curriculum development, to develop the materials that the clubs use, and $5 comes back to Grand Traverse County that gets reinvested into scholarships and activities for children in the program to participate in.
So you really are competing with the Boy Scouts and Girl Scouts for people?
We don't see it as competition.
Well,
we really don't.
You do, but, yeah.
Jason? What's the specific cost of this part of the program, of the 4-H part of your program?
The specific cost of the 4-H program in 2011 was $45,000 and change, would be the specific cost for the salary and fringe benefits for Roxanne's position.
And that's a cost that's as a part of our contribution, or is that the overall cost including your contribution?
That's certainly not the overall cost. That helps offset the salary, fringe, and operating budget. For 2011, the contribution from the Grand Traverse County budget to support this position that Roxanne assumes is $45,866. That's in your 2011 budget. What I'll be discussing with you next is the new memorandum of agreement, the standardized agreement that we're working with county governments across the state to engage all of the resources of Michigan State University, not just predicated on the 4-H position. So that is a change we'll be talking about as soon as we're done with this conversation.
Okay. Any other questions?
I think just one remark, that when we had these regional meetings to talk about the proposed new structure for MSU Extension, there was a debate really about how to present the annual fee, because in essence, MSU Extension does a lot more for county governments than just the 4-H program. And my particular suggestion was that each county just get an assessment of an allocated cost, and it's not designated towards just, the debating, we're funding 4-H or we're not funding 4-H. It's the whole package that you got. Like they're at Northern Michigan counties, and they act as a partner in terms of assisting that organization in speakers and issue identification and management of that, and helping, commissioners get resource information and put stuff together and those kinds of things. And they work very closely with the Michigan Association of Counties. So, and Jim Weising, during his presence here in the county, he used to come in and do strategic planning for us and never charged us and those kinds of things. So there are other values and there are other things that MSU Extension does, but the way they've got it packaged now is you're only seeing the charge is only for like one program, where all the other stuff you're getting, they're not assessing you. And I think you got to take a look at maybe a different viewpoint of this, and saying for $45,000 you're getting 4-H, plus you're getting all the other stuff that they're giving us that they're not billing us for.
Well, I think there's two pieces of that. One, we have to start to recognize all of the services that we get from MSU Extension. And there's a lot more than 4-H. 4-H is such a small, it's very important to me, but it's not necessarily to everybody. But it's a very small portion of the services that are offered to our community by MSU Extension. And I think that's what we need to do, is focus more on what services does MSU Extension provide to our community. And, we're going to get into this new memo, and Pat and I have had discussions. There's a lot of difference between this basic memorandum of agreement and where we are in our 2011 budget. We contribute an awful lot of things to that. But the program, as we seen it 3 years ago, 5 years ago, is going to be different going forward too. So I think we have to start with the basic program, and then we go back in and build what we want. And I think that's what he's here to tell us about this evening.
Welcome, Roxanne, and thanks for coming.
Thank you. I didn't throw anything very hard. Welcome to county government. Thanks for being here tonight. Okay, can I go into the
Absolutely.
memorandum of agreement? All right. I believe in your packets you have 3 documents that were included. 2 documents that are in your packet you've previously seen in prior presentations that I've provided. I provided them again for you this evening as reference tools, so you can refer back to them tonight. The first is a 1-page document called MSU Extensions Redesign. This, again, is a reference tool that you can go back to as a reminder of previous discussions about why we've redesigned MSU Extension. And Commissioner Inman's assessment was pretty accurate in terms of exactly the feedback we got from county government statewide when we asked those questions about how does the partnership work? How does the partnership in terms of the financial relationships work? And we ultimately moved to a new standardized agreement that we're working with all 83 counties in Michigan to engage in. So again, this 1-page handout on the redesign talks about some of the principles of our operational changes. It talks about the 4 new programmatic institutes that our staff are now assigned and work under, and some of the significant changes that have taken place. The second document that, again, you've previously seen, but is called Moving Michigan Forward. And this is some more narrative specifically on the 4 institutes that our staff work within. It just provides more detail for you about the work of those 4 institutes. The final document is what I'll be going over with you tonight, which is the new standard agreement for services, agreement for extension services provided by Michigan State University. And we'll be going over that in some detail. I also, I inadvertently left one handout out of your packet, and I apologize for that. Commissioner Gilman had asked some time ago for an idea of the return on investment. And so I provided that tonight. I put a copy on each of your tables, and that's the multicolored handout that shows a return on investment for every dollar the state invests in extension, how much comes back into Michigan out of that investment. So those are the 4 documents you have in front of you tonight. Again, just please reference back to them at any time or ask questions at any point during my discussion. Going to the actual agreement for services provided by Michigan State University, I'm not going to read this entire document to you. I really want to go over the high points of it and, again, answer your questions. As previously stated by Commissioner Inman, this agreement is not predicated on one program area. It's not based solely on the 4-H program. Our traditional agreement in Grand Traverse County was, because you partially funded the 4-H staff position in this county for decades. That agreement was based on one position. And we had similar agreements across the state, not just based on 4-H, but counties would contract with MSU Extension for a variety of positions, depending on the history of the county, the services that they desired, what they were willing to pay for. And we had these different memorandums of agreement across the state. They were similar, but they were not the same. One of the things we realized in talking to commissioners, talking to administrators, we established an advisory council to give input back to us on this agreement as we worked through it, was we needed a level of standardization, both for the benefit of county government and the benefit of Michigan State University. We also heard that 4-H is very important, but it's not all that you do, and county government should recognize that in a clear sense. And there's the essential element. One of the essential elements of this new agreement is not just based on the 4-H program. It's based on all of the resources of Michigan State University Extension that are available to the citizens of Grand Traverse County and across the state. The basic contributions that MSU Extension will provide in this agreement is access to all 4 of the institutes that we've identified by the residents of your county. And this includes access to educators, not just the people sitting in Grand Traverse County and assigned in Grand Traverse County, but across the state of Michigan. We've moved from a generalist type system where we had an ag agent in a county in a traditional sense that did agriculture work. The day of the generalist is gone. We need to be specialists. And we've assigned our staff into specialist roles. So irregardless of where that specialist sits, that person is going to be available and accessible and provide programming to meet the needs of said audience in Grand Traverse County or beyond. An example of that, in our old system, we were somewhat geographically bound by where we had a person assigned. Let's say there was a program that was offered here in Grand Traverse County that was needed in Lenawee County or Gogebic County or Monroe or anywhere in between. if we did not have another person with that specialty that had a coverage area assignment to cover those counties, we potentially could not offer that program across the state. And that, again, is one of the best strengths of our new system, is we're saying if we're offering a program that's needed in Michigan, and in any of the 83 counties in Michigan, we're going to meet that need, and it's our responsibility to do that, not just where we have someone geographically located. We'll assign staff to work in that county, we'll use technology to serve that need, and we'll make sure that that program's delivered where it's needed. We will provide the salary and benefits of program staff for MSU Extension. In other words, we're assuming the legacy costs on positions. There's been positions in the past that worked for Extension, but were employees of another entity. And we're saying if they're program staff for MSU Extension, we're going to employ them, and we're going to pay the salary and fringe benefits and operating of those staff. And that's another significant change. Included in this is 4-H and the 4-H program coordinator, the position that Roxanne currently sits in. Included in this base assessment is at least a half full-time equivalent or up to 3 full-time equivalents based on the population of the county. In this base assessment, for the 9 counties I cover, the base assessment covers a half-time 4-H program coordinator in each county. In this agreement, I've added another half-time cost into this agreement because I would argue that a half-time position cannot support the existing 4-H community in Grand Traverse County, let alone grow the program or support it at the level it deserves to be supported. We'll provide the administrative oversight for all of our staff, for the operating budgets for our staff and the faculty that develop the research that our programs grow out of. We'll provide supervision of the personnel providing those services, and we'll supervise county clerical staff assigned to the Extension office if desired. The reason that says if desired is because this is a standardized agreement, again, across all the counties. The support staff that we enjoy in the Grand Traverse office are Grand Traverse County employees. We are university employees. There's been some concern expressed in the past about county employees don't work for the university, so how can we supervise them? I can easily say in 99% of the counties it works fine. We've had some ugly incidents, not in this county, but we've had some ugly incidents where the MSU has had a policy that, let's say, a county employee didn't agree with, and that county employee just would not do what we needed them to do because they disagreed with a policy or a decision. And we had no ability to provide direct formative feedback on that person because they're a county employee. So what we're saying is if desired, if Grand Traverse County desires us to provide supervision for those employees, we're going to do that. But we also respect some counties' desire to have the direct reporting lines be within the county system and not within the university system. We have the good fortune in Grand Traverse County of having an office manager in Suzanne Rinke. So the Grand Traverse County employees that work in that office functionally report to Suzanne Rinke. And then I work with Suzanne and provide feedback on her performance to Dennis and Jen and the county government administration. And then we'll report at least once a year on the scope of our services, the audience served, and the impacts of our programs in Grand Traverse County. What we're asking the county to provide is what you currently provide: office space for a county extension office, enough space to at least for the base amount of staff. We have a large office here. MSU has a large investment in Grand Traverse County. We have 6 academic staff that work out of Grand Traverse County. Again, all on our money that we pay for. We're asking for internet access and telephone support because the majority of what we do is web-based. The university is completely paperless at this point. So we need access to the internet, and we provided those connectivity standards that we require so our staff can access the internet to be able to function and do their jobs. In the future, we will provide the computers for our staff, for MSU staff, not county staff. We'll provide the computers, we'll provide the IT support, we'll provide the operating budgets for our staff, where traditionally our staff have operated off of county operating budgets. We're asking for clerical staff to be assigned to the Extension office that will perform clerical functions, first and foremost assisting county residents in accessing the university's resources, whether that be by walk-in, by telephone, by internet, or other means. And then the operating expenses for the office and personnel. When we say that, it's for the county office and the county personnel, because again, we're providing the operating expenses for the university staff. The funding of that is, again, that MSU Extension will pay for the salary and benefits of personnel and the cost of administrative oversight. We're asking the county to pay, and they do, directly for the cost of clerical staff, the salary and benefits, and the general operating cost of the Extension office. We're asking the county to provide an annual assessment that's based on an annual plan of work that is negotiated annually as part of the budgeting process, and that assessment will be charged to the county and administered by Michigan State University. The assessment will fund the operating expenses of personnel, including the 4-H coordinator, and the salary and fringe benefits of the 4-H program coordinator position. Again, the operating costs to be funded from the annual assessment are included in Appendix B. We've broke down in Appendix B a bullet point summary of what I'm saying and is written verbally in this agreement. The specific contributions to the county are listed in Exhibit A, and we'll go over that. We're asking this to be a 5-year agreement. We're not asking for the funding arrangement to be a 5-year agreement. That will be decided upon annually as part of the annual work plan. We're asking for this overarching 2-page agreement to be a 5-year agreement. And the reason that is we want to ensure the commitment of the university to Grand Traverse County and the commitment of Grand Traverse County to the university. Again, the funding arrangements are negotiated annually, but the agreement is a 5-year agreement, which shows commitment on both parties' part and sustains that long-term partnership we've worked with for many years in Grand Traverse County. So this agreement would become effective with the start of the new fiscal year, January 1st, 2012, and would terminate on December 31st, 2017, which is 5 years later. And either the university or the county may terminate this agreement with or without cause with 120 days written notice. And that's standard with our past agreements. So at some point during the engagement in this agreement that Grand Traverse County feels uncomfortable and wants to make a change, this agreement can be terminated with 120 days notice. And the same thing from the university. The general terms under number 5, I'm not an attorney. I didn't write this. Attorneys did. So I'm not going to read those to you again, but if I can answer questions about them, I'll try. So the first 2 pages of this is the standardized agreement. Again, there's no direct dollars attached to this. That's negotiated annually as part of the budget process in the annual plan of work. You'll see that annual plan of work on the 3rd page. It's titled Exhibit A, and it talks about the specific contributions by Michigan State University Extension. Again, it's at least one full-time equivalent extension educator whose primary office of operation will be the county extension office. The reason we say that, because here we have 6, and that's direct benefit to Grand Traverse County. In some of our smaller county units, we have 1 academic staff. We have that currently. And some of the smaller county governments were concerned that in our restructure that they were going to lose their county academic staff member. We have a commitment to we have 82 county extension offices out of 83 counties. Houghton and Keweenaw have always financially contributed to 1 office. So we'll still have 82 offices, and every one of those offices will have at a minimum 1 academic staff from the university. Number 2 is blank. It says blank additional extension educators at the full-time equivalent rate. That's where some counties currently pay for and desire to pay for an educator that works for the university to work on a specific issue within a specific industry with a specific community in the county. We're not asking for Grand Traverse County to fund any full-time extension educators in this agreement. If it's something the county would like to look at in the future, if they want their dedicated single county agricultural educator or natural resources educator, that's something we can consider, but we're not asking for it in this agreement. So that is intentionally left blank. Number 3 is the half-time 4-H program coordinator whose position is included in the assessment, whose primary office of operation is the Grand Traverse County Extension Office. Number 4 is where I'm asking for the additional half FTE to make the position in Grand Traverse County full-time, to provide leadership for the 4-H program. That is an additional cost over the base assessment. 5, 6, 7, and 8 are simply restatements of what I already said in the previous agreement verbally. And again, specific contributions by the county, 1, 2, and 3 are again just restatements of what was in the previous 2-page narrative. Number 4 is the assessment fee itself. The assessment fee for Grand Traverse County to have access to all of the extension and university resources to serve the county is $57,096 for 2012 fiscal year. Where that figure is arrived at, and this goes back to what Commissioner Inman was saying, is we looked at lots of scenarios about how to fund this assessment and how to partner with county government. We looked at population, we looked at SEV, we looked at combinations of population and SEV. We asked county commissioners and county administrators, and the feedback we received was the only equitable and fair way we could do this statewide was base it purely on population. So that's how these assessments statewide are based, is purely on population. It's a $31,000 base assessment plus 30 cents per resident of the county. And we are using 2010 census data. So for Grand Traverse County, that equates to $57,096. And $27,500 for additional personnel, as described above. That additional personnel, that additional $27,500 is to have the 4-H position full-time in Grand Traverse County, serving Grand Traverse County 4-H families. So that total annual assessment for the period of January 1st through December 31st, again, 1 year, is $84,596. That's what this agreement would cover for 2012 fiscal year. The rest of our budget would be negotiated and part of the annual budgeting process that we go through with Grand Traverse County and other counties statewide. So what this agreement would essentially do would be to lock up $84,596 of the general fund contribution to extension for 2012 fiscal year. Appendix A is the technical standards for county internet connections. I didn't write it, I'm not a techie. It just explains the level of connectivity that we need, and we are already there with Grand Traverse County. Dennis, correct me if I'm wrong, but I think...
Yeah, Don Sheehan reviewed it, and we meet all the criteria.
Yeah.
Jason, did you have a question?
Yeah, actually.
Oh, I'm sorry.
I had a couple of things. Dennis, what are we currently, what's our current allocation for staffers for MSU Extension?
I think we're at 5.5 staff, but I think our total budget for MSU is, this is a rough number, $300,000. I think 2 years ago it was more like $400,000.
That's correct.
So it's been cut, but total is about 3.
So right now, we're contributing $300,000 to this
Mhm.
project.
$319,431.
Thank you.
$319,431. All right. And then you're looking at redesigning your services, which includes Greening Michigan Institute, agriculture and agribusiness, which I think it's been assumed that MSU has always had that as a part of its program. Health and nutrition, children and youth, and some of the subtitles here. Health and nutrition. Some of these things are handled by our health department already. It seems redundant. Children and youth, some of the academic success, community capacity building, leadership and civic engagement, career exploration and workforce preparation. We have a career tech center in Grand Traverse County right now. It's a part of the school district. It seems a little redundant. I mean, there are things here that if we're going to be paying for something, maybe we ought to be considering what we really need first. And then we're talking about a 5-year contract. Yeah, you know, 120-day, anybody can drop out, either side can drop out provision. But a lot of these things, when you're coming into the, preparing for the next year and you're budgeting for the next year and everything, 120 days, then you have to back up your budgeting process another 120 days to take a look at whether or not that is worthwhile going forward. And then it's kind of open-ended in a number of other ways. We got $84,000 or $84,596 for this assessment. And are we paying an assessment right now? Is that a part of what we're paying right now?
No, the only commitment made by Pat and MSU was that depending on what we negotiate, this was designed in a way that the county would not pay any more than what we're currently paying. And he's lived up to that. So, no, there is no assessment. It's completely different than our current relationship.
Okay, so, but we're looking at an assessment, and then we're looking at the additional full-time rate for a number of positions proposed. I mean, and then, here we are, we're looking at tough decision-making that has to happen. You guys, the budget people have been getting together, and we got a big chunk to knock off. And I got to tell you, this looks like steak to me right now. I mean, I'm afraid that, I don't see a lot of these things as being real important right now. I think that there are some parts of it. We do have an agricultural community. I think there are some parts of it where if we could get back to having that guy who is the liaison with the MSU office, and keep our costs to a minimum, that would be ideal. But all these additional things and duplication of services that we already provide, I think, I don't know, I just don't know if it's real value.
I'm not sure if there was a question there, but I'll do my best to. Agriculture is the second leading industry in the state of Michigan. If you look at the agricultural receipts for Grand Traverse County, they're enormous. It's the only growing industry in the state. And Michigan State University is the research and development arm of agriculture for the state. In terms of repetitive programs, specifically one example I'll use is the health and nutrition. We provide their supplemental nutrition assistance program, which is a federally funded grant across the state of Michigan. And we work with low-income, food stamp eligible families, all of the school districts in Grand Traverse County that are above 50% free and reduced lunch. We work in those schools to help those families stretch their limited dollars in the healthiest means for families. That's not something the health department's doing. We partner with the health department. We work with others, but that's certainly not something that we're doing. If we are finding areas that we are duplication of services, it's certainly not our intent.
Well, as far as, and going to that even, if it's in the schools have an obligation to provide a healthy lunch. I mean, if that's what they've been told to do, do we need to have an additional entity come in and help them do what they're supposed to be doing already?
The services that are provided are not dealing with providing the school with the information about how to provide a healthy lunch. It's to help to educate the children of what is a healthy meal when they go home, and to help to educate the community to that and the families to that.
Another example is Project Fresh, or Senior Project Fresh, where we work with the community farm markets, where local producers of agricultural products bring in, and they have a local vehicle to sell their produce. Low-income families have coupons that they receive through this program that are vouchers. They can buy fresh produce. That's all they can buy is the fresh produce to take home, again, to serve to their families. Then those vouchers get turned back in by the producers, by the farmers, that can cash them in. We do that in partnership with the Commission on Aging and others.
Rob, you had a question?
Yeah. 6 days ago, I got the packet for this meeting, which I read right away, and right away I had questions. And I emailed 11 specific budget items I'd like to see listed out. What are the actual costs? And I didn't get anything in return. When I sat down, there's one of the questions addressed here, and sir, you did show me some numbers from those questions. What I really wanted was a list of answers to a list of questions. And apparently there wasn't time. I would move to refer this agreement to the June Public Health and Safety to give time to provide the information for my questions and perhaps any others that may have some questions.
Support.
We have a motion by Henschel, supported by Maxwell. Ross, you had a question? Comment?
Well, it's not on his motion, but I was just going to say in general, the programs that MSU provides, Extension Service provides here, I think are some of the most valuable programs that the county, that this board funds. We have some very smart, very educated people who are working on improving agriculture and improving the ability of our citizens to make money through agriculture and to increase their reach, to make our citizens healthier, and through all that, in just the 2 years I've been on the board, I've witnessed a huge drop in the funding, which is partially us, but mostly it's been from the state of Michigan, and I don't understand what the problem is. I guess I would think that we would be more than willing to fund these programs because they're actually programs that do some good long range and short range for the county of Grand Traverse.
Larry?
Well, I guess I'm on the same side that Ross is on, that I've seen and heard so many success stories with families and kids, and how this program has affected them and has developed life skills for them in terms of responsibility and those types of things that, you know, when you take a look at kids getting in trouble and hanging around the wrong group of other kids getting in trouble, I mean, this is one really dynamic program that can really turn a kid around. And, you know, so I'm very supportive of it. And you can't, you know, it's tough to put a dollar amount on that. You know, you take a look at our fund that we have for the child care fund for, you know, diversion for juveniles to incarceration. And can you imagine if Grand Traverse County, this is my own personal opinion, just randomly just dropped everything that really is helping kids turn in the right direction? You know, that fund could double. You know, so in terms of the questions that Rob has, I'm fine with delaying the discussion with having with more information that Rob would like to see in more detail. And I'm just wondering, rather than delaying this thing a month, I mean, is it possible that you could get with Dennis and then get this thing at Ways and Means for this month or something like that, and we can just take a look at it this month again?
Well, to answer your question, the purpose of this being presented today was possibly to recommend accepting a 5-year agreement, and I don't feel comfortable recommending that without having my questions answered first. I mean, I represent a lot of people, and for me to just flippantly just go along with the crowd, it's not my job.
And I support your rationale behind that. I'm just wondering if, you know, in the next week or 10 days, can that be accomplished?
Pat, is there any rush to get this approved? Would it cause any problems if this isn't approved until June or considered until June?
No. The answer to your question is no. We can bring this back in June. We're going through our budget planning process ourselves. And again, as a reminder, for every $1 that the county invests, we invest about $5 back into that office. For our budgeting planning budgeting purposes, we're currently working these agreements through county government statewide. We've gotten Leelanau County, Charlevoix County, Manistee County. Those are the 3 counties in my district that approved these last week. And so it's important to us to make sure and secure this partnership. This is not for the entire appropriation from Grand Traverse County. This is for the MSU investment that secures the university investment back into Grand Traverse County. We've talked about but a couple of the programs here today. And we could go through all of the programs that we're involved with. It would take a lot of time and a lot of people that those programs impact. Your questions, your email was never forwarded to me, with all due respect, Commissioner Henschel. I didn't receive that. It was forwarded to me later on, and I was able to look. We have 14 phone lines in the office. Our budget for phones is $7,600 this year. The space costs, I have no idea. I think Commissioner,
I have that right here.
Administrator Aloya provided that. I don't know what other questions. If I could answer them for you, I'd be glad to.
Basically Appendix B, but, you know, I kind of wanted them in writing, so if I had further questions, you know, I could think about it. You know, in the heat of a moment at a meeting, it's real easy to not think about things and just skip right over them. That's why I immediately emailed back and said, well, what's this? And, you know, I run a family business with my family, and when I look at an agreement and it says you'll provide this, this, and this, well, I mean, some of the stuff's kind of vague. You'll provide, you know, office space. And that's all I said. And that's why I said, well, wait, what's the dollar amount on that? Because that's, you know, that's our job in this commission, is to manage the dollars of the county. And that's why I immediately, you know, I said, I want to see the numbers, especially if we're talking about a 5-year commitment. You know, what are historical numbers and what are we expecting this to cost? You know, and it's no secret, we've got to cut back somewhere in this county, because there's going to be a deficit next year if we don't.
Jason?
You know, don't get me wrong. I think that the extension has an important place. Okay, I think it's a level discussion is where I'm going. You know, one thing that, you know, we have to all remember: agriculture is an industry. Am I correct?
Correct.
It is an industry. Medicine is an industry. Furniture making is an industry. See, you know, we could have a program that helps train furniture makers, or helps train doctors that we can pay for with taxpayer dollars. And to Larry's point, with the kids and keeping kids involved, I got to tell you, it reaches a point where we start trying to do so much with county or state or federal dollars, and then which requires a lot of us to work 2 jobs so that we can pay the bills. Well, if we're working 2 jobs, we're not home with those kids. And then we're supposed to have some kind of program to keep them out of trouble. If we're home with them, they wouldn't be in trouble in the first place. So, again, I tend to go back to my philosophical roots on some of this stuff. I think there is a place for the extension. I think there is a place where we can help, build a stronger community with programs that encourage best practices and land stewardship, but and that actually saves us money in the end. But I think there's an overreach, and it's an attempt to maybe build MSU's program or to build its platform, perhaps. But I think right now we're looking at costs, and it's a very expensive cost to us right now.
Chris?
I supported Commissioner Henschel's motion primarily because I think that his questions deserve to be answered. And I would support any commissioner's motion who submitted questions many days ago and has not received answers yet. That being said, I do think that, just so you know, I really am reluctant to support this primarily because of the 4-H aspect. It's not that I'm opposed to 4-H. I think 4-H is great, but I think the Boy Scouts are great. I think the Girl Scouts are great. I think the YMCA gymnastic clubs are great. I can go on and on. We don't have any objective way right now to rate programs, and everybody's program is good. Your program is good. 4-H is good. The TART Trails is a good program. I'm reluctant to support this primarily because of the 4-H. But that being said, I do have some additional questions, and I've taken some notes during this discussion, and I'll be asking them.
Okay. Did I miss a motion while I was getting a drink of water?
No, we got one.
Do we have a motion to defer it to next month's public safety meeting?
Well, okay, then, what I was going to say then was probably the proper place for this to come up is at Ways and Means.
Well, that's what I brought up. I mean, between now and Ways and Means, the Ways and Means packet coming out, I mean, is it feasible to get all the...
Why is it here then?
Huh?
Then why is it here?
I didn't put it here.
Why is it here?
Why
This
isn't
is
it
the
here?
committee that it typically comes to.
Okay.
This is part of our...
Yeah, but,
But we could consider it at Ways and Means.
You can consider it at
You're
Ways
talking
and
about
Means,
money.
because it's a financial issue.
Herb, you had a question?
Yeah, I've been a strong supporter of the extension programs for many, many years. The dollar returns that we invest into this programs and what we get back is beyond what any other organization program that we do. My challenge with this is the additional halftime for the 4-H. We've done without that. We are looking at budget restrictions and what we're going to be doing. So I'm asking whether or not we have to pay for the additional halftime extension and just put it as part of the halftime that we are already getting and leave it there.
In the current situation, we're already funding that
We're
position
paying
100%.
halftime.
No, right now, we're paying 100% of it.
Are we?
We've always had a full-time 4-H position in Grand Traverse County.
And actually, it's been at a higher level. MSU is moving these down to coordinators with oversight by a director at a higher level.
Okay.
So this is actually less expensive than what we've been paying.
I was concerned that we were adding
No.
an additional
No, this is
staff,
no issue.
additional person. Okay.
Our commitment, again, as a reminder from the beginning, was this will be cost neutral or better for county government. We will work within the fiscal parameters that county government provides. What I'm asking you to consider this proposal tonight, which does lock up the $84,000 of a $319,000 budget. The remaining support for the Extension Office that comes into clerical support. A lot of the line items that are currently provided in the county budget will be decreased or will be zeroed out under this new agreement, because we'll provide the operational budgets for our staff, we'll provide the IT, we'll provide the computers.
So again, we'll work within the fiscal constraints that the county provides, and we would negotiate the rest of that budget during the regular budgetary process. This agreement ties in the university investment in Grand Traverse County. This agreement is what leverages the university's investment. It's not a cafeteria plan where we can pick and choose which pieces we like and which ones we don't. These are the services provided by Michigan State University Extension across the state, and that's what the agreement's based on, again, in a standardized format. Because the concern we had before was counties specifically would say, we want this or we want that, and then we heard negative feedback from counties, because why does County X get this but we don't? So it's a bit of a push and pull on that discussion.
The other question I had was, is that if it was possibility that rather than us having staff, if you would contract for the staff that we have for the office. You know, one of the things I'm pushing on is whether or not we contract a lot of different services. And so whether or not we could, you know, maybe not have staff for you, but you provide that staff and we pay for it. And if it was competitively bid.
Well, I sat on the advisory committee with MSU to put this together, and Commissioner, that was, Pat will tell you, that was one of my main things.
Yeah.
I would have rather seen all the personnel under the state and the county contract for whatever services we want. The difficulty with that is, as you might expect, all these county employees that have supported MSU Extension for many, many years are in various stages of their careers. We have employees here that aren't even vested. We have other employees that are fully vested in our retirement. If we turned them all over to the state, they could lose retirements, they could lose benefits, that stuff has changed. So, you know, what I've asked them to consider is, as attrition comes about, could we start moving services over in contract? In terms of competitively, I don't think that's a discussion we had at this point in time, but I do believe that I agree with your idea that I would rather see them all in one place as opposed to what we currently have, but practically it wasn't feasible to do at this time.
But it would be nice if we did start to do it through attrition, that we continue to put them into MSUs.
I agree. One of the things I'd like to, I don't know how we can get to this. Did you have an opportunity to? Did you offer to? I'm sorry, I don't know this. Did you have meetings with commissioners or offer to do orientations with commissioners?
We did.
And you were successful in getting those done?
2 commissioners.
Okay. So one of the things that I find that I think it's better to follow Commissioner Henschel's recommendation and hold off on this is because I think there's a lot more issues here than we can solve in 4 or 5 or 6 or 7 days. You know, I can't even begin to tell you. All I can do is ask you to have some confidence in me that our experience, whether it's with the courts, whether it's with the health department and MSU Extension, we coordinate a great number of services between them. And so the issue of redundancy, I need to get some better handle on what you think might be redundant so we can kind of show you that, that I think it's not. I can tell you that I've been very supportive of MSU. I've never been a participant in 4-H, but I can remember back 7 or 8 years ago when the county board was facing what Commissioner Inman said, a great increase in the cost of our child care fund. Right. And we were getting a lot more kids that were being put into really serious care because of a variety of things. But at that time, I remember the county board in several areas saying, we are going to make an investment in our youth in order to provide them with tools they need to stay on the right track. And the rationale, frankly, was, because if we don't, many of them are going to end up in our jails. Many of them are going to end up in our courts. Many of them are going to end up in our police agencies. And the county board at that time said, this is an investment well worth making in our youth to kind of help keep them on the straight and narrow, for those, especially those who have families, parents that have to work 2 jobs and those kinds of things. So, you know, I strongly believe that there's little redundancy in the programs. I strongly believe that they're good programs. But this is the kind of difficult decision the county board will have to make in terms of what you feel you can provide and what you don't. The reason I was comfortable with this contract is these are basic services. And the never occurred to me that we may not be a partner with MSU. So $84,000 out of $319,000 seemed like a reasonable beginning on this. And I really, as I told the Budget Committee tonight, I would expect there would be a lot more discussion of the remaining
Differential.
yeah, which is $230,000, and what we might do, particularly in the area of the clerical support and those kinds of things. But I thought that was that part of it is a 2012 discussion. But I certainly respect the Commission's questions, and I think that these are good things that we need to answer, and answer thoroughly, so that Commissioners have the information they need. And I really agree with Commissioner Henschel, waiting the extra 3 weeks are important.
Ross, you have a question? Okay, I guess I'm going to get my part in here first, Jason, then I'll let you. I personally don't have a problem with the basic contract, and I made the comment earlier, I think there's a long ways between the basic contract and the $300,000 that we're at this year, that we definitely have to have the discussion about. But, I don't have a problem with delaying it because it's a contract that actually goes into effect January 1st. If someone genuinely has questions that we need to answer, we need to make sure we have that information so everyone's comfortable with the decision. But at least in my mind, from my perspective, there's no question that I want to see Grand Traverse County partnered with MSU Extension. So, Jason?
Could I get you to email me? When I asked for the dollars returned, I'm really looking for a little fleshing out of the details. I could say to you, because I'm a county commissioner, every tax dollar paid gets every constituent $50, and I don't have anything to back it up. This doesn't have anything to back it up. Could I get you to email me Stephen Miller's, his analysis, if that's possible? Because I'd like to see where he bases the community benefits of $6.10 back, and how we get to a 17-to-1 ratio for dollars spent. And it doesn't even add up on this sheet. I'm just trying to figure that out myself right now. So if we could do that, I think that would help us greatly.
One of the things I might add, because I asked the same question, I really understand where the Commissioners are at on this issue of 4-H. Because, and Pat, you may recall this, or maybe I had the discussion with Tom Kuhn. When I saw the agreement the first time, I said, why is it that everything else is going to be addressed separately, but 4-H is in the fundamental agreement? And I can't remember if it was Tom who answered it for me, or if it was you that answered it for me, Pat. Did we have this discussion, you and I?
Yeah.
Okay.
Yeah, it's the one program we hear from all 83 counties in the state that is the one program in every county that says it's necessary. That's why 4-H is part of the standard agreement with everything else. It's the one program we heard resoundingly clear statewide. We need our county 4-H staff.
I remember a few months ago, probably 6 months ago, Kalkaska County had a discussion about eliminating their 4-H program. And they filled the Coliseum and people standing outside the building.
Yeah.
So
They changed their mind.
And they revisited the issue. Okay, we have a motion on the floor to table this for a month to get all of the answers. Is there any further discussion before we take a vote on that motion?
Sonny, he's got a question over here.
I just wanted a point of clarity was asked, the time-sensitive nature of this. And yes, it is a January contract because that's the start of the county's fiscal year. Our fiscal year is July 1st to June 30th. That is why we are bringing these contracts forward and discussing these, because as I said, we're going through our budgetary and planning processes right now.
We understand the concern, Pat, and we understand the timing, but I think from your perspective, and I know you understand this, you also have to understand this is a major change in direction, and while I certainly am in agreement, the Commission needs some time to understand this, with this major change, and I think that's just the way it is. The County Board can act on this first week in June and give you a sense of where this is going, but I think we have to respect that.
I certainly respect that, and that my statement was not disrespectful.
Maybe we can vote on it at Ways and Means, if all the answers are ready.
I would just encourage you to get your questions to Pat as soon as you can. And Pat, I'm going to want to talk to you after this, because I want to find out why you had a delay in getting Commissioner Henschel's questions, and I want to get to the bottom of that. So, but let's get the questions to him as quickly as we can, and we'll get answers. Whoever asks questions, we'll disseminate those answers to all commissioners so that you all have that.
I appreciate your time this evening.
Thanks, Pat.
Okay. Roll call vote, please.
Commissioner Lemkool?
Yes.
Max Bauer?
Yes.
Richardson?
No.
Thomas?
No. No.
Chairman Wheelock?
No.
Please?
No.
Gilman?
Yes.
Henschel?
Yes.
Inman?
Yes.
Okay, motion passed to delay this for 1 month. Okay?
The motion was to...
To delay.
The motion passed 5-4
To delay it for 1 month.
Delay it for 1 month.
I didn't count it right.
Unfinished business?
None.
New business. Commissioner Inman has asked about AEDs.
Yeah, if I could have Jen come up. Just let me give a quick explanation of this, and then I'll let them take over. At the last Martin Luther King Training Day, they had a session on first aid as well as the AEDs. And after the session, I thought about it for a while and had wondered, how many actual AEDs do we have in the buildings that the county owns, and how many people at the county actually have a first aid card that could help somebody that if they drop on the floor and their heart stops or whatever, or can't breathe or whatever. But so in any event, I asked, I basically sent an inquiry over, and Jen really took the lead on it and took it to the safety committee, and I said let them evaluate it and come up with a recommendation.
Jen Seaman, Human Resources Director.
Suzanne Cork, I'm a nurse at the health department, also safety coordinator, and I also teach CPR.
We looked into this, the safety committee did look into this, and first of all, we do have AEDs located at the Civic Center, the health department, in the jail, and all the call for service sheriff's department cars. As you'll see in the memo, we said if money were no option, ideally you'd have an AED at every building. However, money is an option, and with AEDs costing anywhere from $1,500 to $2,000, plus the replacement pads and batteries, you're looking at up to $2,500 possibly for that AED. So we said, well, how about we narrow it down where we have the most public traffic as well as the most employees, and that's what we recommended. That's why we recommended the Lafreniere Building, the Gov Center, and Front Street. I would also like to add that did look into the Senior Center building, even though that's coming to be the county, and they do have an AED there. So just for the record, and as Larry mentioned earlier this year, we had about 170 employees that were trained in how to use the AEDs. The Red Cross came over and did training on that and showed employees how to use those. The main concern is our staff ready in an emergency situation? We really don't believe so. In addition to the AEDs, we believe that there's some additional CPR and first aid training that could be done, and possibly having 1 to 2, maybe 3 employees per floor that are trained in CPR and first aid, so that if CPR had to be administered while an AED arrived, say by the sheriff's department in one of those call for service cars, or maybe something happened here, we could run over to the jail to get that AED, that at least we could have someone trained in CPR to buy us that time until that got here. So that's, really the main concern is that we, provide some training to our employees, and relatively would be at a minimal cost. We have, Sue is trained to provide that training, as well as two or three of our employees at the Civic Center, at the pool. I can't recall exactly if it's 2 or 3, but, it would be their county time, but we would not have to pay for a trainer. So just their time here at work. So another thing to keep in mind. Did I miss anything?
I don't think so. I truly believe AEDs are great, but I think the training is
having someone do CPR till the AED gets there is just a good idea, but you just have to remember too, it's got to be part of a program. We can't just put AEDs in. There's a yearly cost that continues with the pads and the batteries and the training, and it has to be a program. It can't just throw an AED in a building. You have to do it as a program.
Chris?
When I worked for Shell, we had CPR training annually. And I really would like to see, during our Martin Luther King training day, I would like to see all employees have that option of taking the CPR training. I honestly think that's more important than the AED, because when you stop and think about it, all of our buildings are within pretty short reach of the fire departments and, the city police and
And the jail.
and the jail, where an AED, could be brought very quickly. I think CPR is really makes a difference. So I just wanted to put that out there.
This really hit home. I was just concerned about it initially, that, with a building that gets a lot of traffic, not only from employees but from the public, having one here would be very valuable in my mind. And it really hit home when I sat down with Katie, and she told me about her father collapsing in I believe a public building. And there was someone there right on the spot that was trained in CPR, and his heart stopped, all right? And they were doing CPR, the other person ran, they had an AED in that building, all right? And by the time that person got that AED and ran to get it and came back, 3 minutes had lapsed, okay? They shocked him. His heart started rhythm again. They took him to the emergency room at the hospital. And quite frankly, the physicians, when they were told his heart had stopped for about 3 minutes, they were concerned about brain damage, okay? And he did come back with some, short-term loss of memory and those kinds of things. But, when you hear that kind of a story, I don't want to have somebody have a situation where they collapse in our building, and we got to run to another building to get an AED or wait for a cruiser to come up and do this. I'd want that AED in this building, and the employees would know where it was at. And I'm really supportive of at least having a couple people trained in CPR and first aid, so, we can have, if something does happen, at least we have some coverage.
Yeah, if my recollection is right, I thought somebody donated one for Power Island a number of years ago, and then it was pulled from Power Island, if I remember correctly. I'm not sure what I just heard vaguely.
Too far to get it.
I know that this was before my time, but I understand that Dennis LaBelle's wife, Patty,
Did a fundraiser.
had a fundraiser
Right.
to bring those AEDs into the county, and I think at the time we got 4 or 5 AEDs. But that's the only one I'm aware of, Commissioner. I'm not aware of one at Power Island.
But I really think that the
Maybe
senior
Sue
centers
knows.
would be an additional thing that we ought to be putting one over there
Jen said there
and
was
train the
one there.
people.
There's one there.
There is one.
But I don't know.
Oh, there is one in the senior center? Okay.
Yeah, it's not.
But,
mentioned
for
here, but
example,
it is.
this building, I don't know why we couldn't convince the city to split the cost with us. That would be, to me, that'd be an easy decision, yes.
That's true.
Yes, I have a little, just a question. Sue, when they were trained CPR at Martin Luther King Day, was that the new standards?
Actually, they didn't teach CPR.
They didn't
just
teach the training.
use of an AED. It was just like an overview of the use of AEDs.
Because,
There was no CPR
if you took
involved.
CPR training 5 years ago, it's
Yeah.
100% different today than it was 5 years ago. So, even though it's still going to move blood around through the body, the current standards are significantly different. So, as we think about this, and we think about, I absolutely agree. The AEDs are fine. They're a fine piece of machinery. I've used one several times, but the fact is that, if you don't do the part first, the AED won't
Right.
get you there.
Yeah, you gotta get both.
And the standards have changed to the point, I can remember the days when, of course, I've been doing it long enough to, I remember the days when you absolutely had to have the AED hooked up within 90 seconds and be shocking the patient. Well, we don't do that anymore. We do CPR for some time. And I remember, switching people on the third breath so you didn't, or on compression so you didn't miss a breath, and now we're doing compressions only CPR. So there's some significant differences in the way we think about doing CPR today than the way we did it 5 years ago or 10 years ago or longer. So, I absolutely support the idea of creating a program where we educate our people how to do CPR. I think that's much more important than the actual AED is, because the AEDs are in the ambulances, they're in the patrol cars, they're in a lot of the buildings. If I had to choose one or the other, I would do the training first every time.
What is the safety committee asking the commissioners for?
We're not really asking you for anything. We're making a recommendation based upon the knowledge of the committee. There's various representatives from all over, but we believe first and foremost, minimally what should be done is CPR and first aid training. An AED here at the Gov Center would be probably the next step, but minimally to provide that training and have that training for employees. Correct?
Right.
Mm-hmm.
I mean, Larry came to us and asked us for a recommendation.
But Front Street Commission on Aging could put that in from their budget.
Sure.
And
If they, yeah.
I guess we need to have more of a...
And they are close to the fire department, too.
They're right next door to the fire
Yeah, they got a fire
department.
department there,
It's
so, I
like,
mean,
hello.
Well, I think they're saying the recommendation is do CPR training.
Yeah.
And then if you want to consider AEDs, consider them in the 2012 budget.
Okay.
Is that correct?
I'm just curious how far your recommendation, how detailed it is, who should get the training, what will it cost, how many people are we talking about? Because, it's the main thing I look at is the dollars. We're the budget people here, and how much money are you asking us to spend, and what's the result?
We're suggesting 1 to 3 employees per floor at each location so that they're nearby. The cost would be the time to do it, because we have trainers available on site, so it's just their hourly costs, what we would pay them, their salary or hourly wage to do.
I think we need to get an average of that, Jen.
Oh, okay.
3 people, this many hours, trainer, this many hours.
Dennis
That's what-
costs
that's
more
what
than a
he's
lot of
looking
people.
for. That's right, I wouldn't know.
He's not, yeah.
You should.
Okay, we can absolutely get a cost on that.
Well, I would say,
I can work with you on that.
we definitely should put together a program, and hopefully we could do that very soon with a description of the trainings, because, starting CPR is what now, 12 hours?
You could do just adult only in a couple hours.
Oh, yeah,
If
do
you
it-
just
if you-
wanted to do adult only CPR with
I've just
an
done
AED,
professional rescuer so long, I
Yeah.
can't remember what the real street is
maybe
anymore.
2.5 hours.
So, so we could put together a program pretty easily with, say, 2 or 3 training programs available, here in the within the county, whether we held them all here, whether we held one of them here, one of them at the Lafreniere building, and, one of them at the health department or whatever. We would facilitate the trainings and make them available to whoever wanted to come, any county employee who wanted to come. Because when you're doing the class, it really doesn't make a whole lot of difference whether you have 3 people in the class or whether
That's
you
true.
have 12 people in the class.
You are each instructor is limited to how many people they can, be sick.
Would you are you waving at me?
My
or would you
hands,
like to
my arms
speak?
getting tired.
Okay. You're
I
fine.
just wanted to do this. I've always wanted to do this. We had a call in from a viewer. I received an email from a viewer. I always wanted to do that. Bob Hall emailed in to say, just for your information, all of our corrections officers are trained in CPR and AED, and they have 3 officers over there who are certified instructors. So we could look
All
at
right.
using them too. I just always wanted to do that.
Larry?
Thanks, Bob.
For
Thanks, Bob.
selfish reasons, and going back to what Chris had said, I think it should be mandatory that every county employee have basic first aid and CPR training. And the selfishness comes in, it doesn't happen just at work.
That's right.
Everybody sitting at this table has family. Everybody in the room has family. And I'd received the training many, many years ago. And a week after the Heimlich maneuver, I happened to be at a local restaurant, and a gentleman started choking on a piece of steak. He's seated with his wife and another couple, and everybody in the restaurant's just staring, and this guy went through all the classic symptoms. And had I not had that training, I probably wouldn't have known what to do, but I just got up, never said a word, walked over, did the maneuver on him, out popped the steak, and that gentleman was very thankful. But it's your family that you need to protect. The training is minimal for the benefit you get out of it, even if you don't stay current. Like with basic first aid, it can save your life 4 years later. And I think it ought to be mandatory for all county employees, because you're only here a third of the time. It's the other 2/3 of the time when it's your own family that becomes very important.
Dennis?
I just wanted to say, I think a good way to start this would be first to assess how many certified people we have certified in CPR. That'd be the first thing. If we find that we have several on each floor, for example, then my suggestion might be that we make this training available on Martin Luther King Day, so there's no additional cost, and that we offer it 4 or 5 times during that day, so that many, many employees could get trained in it. And if we find that we don't have many trained, then I think we could make some arrangements, get some cost estimates for you, and make some arrangements to do specialized training still this year, so that we have that from this point on. But I know we've had CPR training several times over the years at Martin Luther King. Now, maybe they're all out of date, but I think we should assess that first and kind of see where we're at with people. I just don't know where we are.
Larry?
What was the time commitment for a first aid card, which would also include CPR, but, I mean, it seems like they were talking about that they have, the Red Cross was there, and they were saying...
American Heart is 2 years.
Huh?
American, you mean how long is your card good for?
No, how long was the training program for the American Red Cross? When she was there saying that, we have this training program, here's a card, you get 10% off if you call this number or whatever. I mean, typically, what's the length of time to get a first aid card?
To get trained.
First aid.
It wasn't a 2-hour session.
No, that would be just like CPR would be
Right.
about 3 hours. I would,
That one? That's 4.5 hours. And then the second day it's 3.5.
when I teach CPR and first aid, it's probably about 8 hours.
8 hour?
For adult, child, infant, CPR and first aid. It's
So what do you do, like, 3 or 4 3-hour classes or something like that?
depending, yeah.
So,
At one time, the fire department did a mass community first aid training at the different stations, and maybe this is an opportunity to ask them to be able to participate and be able to, and that could be available to our employees, plus to the regular community, and try and do as many as we possibly can.
Well, and actually, right now might be a good time to actually continue to have that discussion because of the new standards.
So we want to give them direction?
Yeah, I think probably, we've had enough discussion that they can go out and put together some sort of an assessment. Dennis is exactly right. We need to do an assessment of how many people we have, but, my concern is the fact that the new standards are enough different than the old standards. We really need to assess that.
Well, then what we need to
in
do is,
mind.
we need to put a cost estimate together for you to give you an idea
I really
of how much
think
it'll
we
cost
do.
to train.
Because of the new standards, I think we truly do need to talk about it from this point going forward.
Fair enough. Good.
Thank you for
Thank you.
staying.
Thank you for bringing
Appreciate
it
it.
up, Larry.
Thanks, guys.
When are we going to get that?
Budget. Do we have,
I think we'll be able to give you a cost estimate probably within the next couple of days, and we'll email it to you.
Oh,
We'll just put it on the
Maybe we
RMA
can-
agenda or the Ways
Maybe
and
we
Means
can
agenda, whatever.
approve it at Ways and
Whatever you
Means or
want to do.
All right.
Well, it'll take us a while longer to assess who may be certified and
Yeah,
who's
that's
not.
true.
Yeah.
So, but
I
we
mean,
will
if
get
it's
you
30
the
days later,
information
it's
on
fine.
cost right away.
Yeah, 30 days later is fine.
yeah, we got, on the 9th of June, we've got the safety
Okay.
committee meeting, so.
All right, this brings us to our second opportunity for public comment. Is there anyone in the audience wishing to make comment at this time? Seeing none, we'll move forward. Commissioner reports? Reminder, tomorrow at noon is the annual Road Commission Michigan Townships Association luncheon at the Elks, if you've previously RSVP'd, otherwise you probably won't get anything to eat. The other piece I'm just going to mention, and I'll mention it again tomorrow, and I can't remember if I mentioned it at the Board of Commissioners meeting, the final draft of the first amendment to the solid waste plan has been sent out to all of the townships along with a sample resolution for them to approve that. Public input time expires on, the mandatory 90-day public inputs time expires May 15th. The Solid Waste Planning Committee meets on the 19th, and we'll be trying to bring you a resolution, hopefully at your May Board of Commissioners meeting, to approve the resolution. Remember, at that point, then it has to go out and be ratified by 2/3 of the 13 townships, the 2 villages, and the city. So, and that all has to have taken place before we can submit it to the state, and then after that's done, then the state would be able to license and authorize the opening of the new facility that American Waste is opening on Hughes Drive. Coming shortly behind that, probably September, October, will be an overview, front cover to back cover of the county solids waste plan. Something that's going to actually be readable and make sense in our community. So the committee's working pretty hard at it.
Can I ask you a question about the waste plan?
Yes.
I remember a number of years back, not American Waste, Waste Management seemed to be just getting all the business in town, and they owned the landfills, and basically they could set the rate on the landfill, and the competitors just had to deal with it. With this change to the waste plan, we're allowing American Waste to have a recycling center, which is the new landfill. Is this going to set up a similar situation like with Waste Management where they control where the waste goes?
No.
Okay.
Well, I guess that's the simple answer. The true fact is the amendment to the solid waste plan actually makes this MRF facility a designated facility, just like Glenn's landfill is. The difference is the current county solid waste plan, which was written in 1998, has Waste Management controlling 98% of the market. That's not the case today. We have 5 companies that are actively providing solid waste in Grand Traverse County. And the biggest difference is the technology has changed and all of those kind of things. But remember, more importantly, and we can discuss this more when we talk about the second amendment, the solid waste plan that's currently in place that was adopted in March of 1999, if my memory is correct, requires and stipulates that Grand Traverse County will site a landfill on property. It specifically says that we will site a landfill on property we own in Whitewater Township. It requires that the county operate its own MRF facility, and that the county contracts countywide for solid waste. That's not what our community is supporting, and therefore that stuff needs to be rewritten to where it's in concurrence with what the community wants to do.
Okay.
And the other piece is that the current county solid waste plan, as it's approved by the DEQ, talks consistently about the intergovernmental contracts between the townships and the county. And remember, those contracts or intergovernmental agreements are with the County Board of Public Works, not with the Grand Traverse County Board of Commissioners. So as we look at restructuring resource recovery and all of those kind of things, we've talked about whether it comes in under the county board, and I think Dennis is going to have you a proposal for that sometime probably about June. And when that all happens, we take the Board of Public Works out of it, but remember that those intergovernmental agreements all went away in December 31st of 2010. So right now, the part of the question is just exactly what authority does the county have to enforce solid waste management in those townships, because we don't have the intergovernmental agreements in place. But the state law requires every county to have a county solid waste plan. So, right now, we've got a solid waste plan, but there's a lot of it that doesn't fit our community. And, I don't think any of us want to designate to our townships, how they're going to handle their waste. So, I'm very excited about amendment number 2, even more than amendment number 1. We did amendment number 1 on a fast track to get this new facility open, because it's going to be an asset to our community. Okay? Herb?
Just to let you know that Long Lake Township costs them $120 a year more for trash than it does for me in Garfield Township. So it's just quite a difference.
Yeah. I just want to take a second to follow up on CMH, Community Mental Health report I gave a few weeks ago about the sheriff of Roscommon County had sent a bill to CMH because he thought they basically responded too slow, and it cost them man-hours with their sheriff's department. And what we did with it was we unanimously decided just to send them a letter back saying, we're sorry this happened. We're taking steps to make sure it doesn't happen again, but as far as paying a bill for labor, we can't do it because it sets a precedent to where we may be getting bills from all the counties and every department, and it just didn't make sense to do that.
Interesting.
Anyone
I
else?
hope he doesn't sue you.
Yeah.
Okay, any notices or announcements? Dennis?
Just one quick one. The board directed me to look at putting together a cost estimate and a process for surveying the public as to what programs are important. Had a meeting with representatives of NMC on Monday. This turns out to be quite complicated. I didn't realize, but the difficulty is that any survey you do has to be reasonable in size or people won't fill it out. And when we started explaining all the programs, all the departments we have, they said, that's just, you can't survey at that level. So we're still putting a proposal together, and there'll be a cost associated with, but what it's going to require we do is maybe ask somewhere between strategic planning questions and specific programmatic questions. So we might have to ask questions like, how do you rank the support of supporting veterans? Okay, and then we would have to look at our programs and say, oh, here's a program that supports veterans, here's a program in another department that supports veterans. Okay, so they meet that goal. Do you see what I'm saying? Or it might say services for the indigent. It won't say WIC services, it won't say family planning, it won't say this, it won't be specific. It's going to have to be more on a little bit higher level. And we think that's going to mean 50 questions alone if we do that. And so we're trying to put together right now some of those main categories to get back to NMC so they can evaluate it and come back with a cost estimate to do that. And a plan for you to consider. So I just wanted you to be aware, this is not something I'm going to have an answer for in a week. It's going to take a little while to design. They do still believe we could have results back by the end of, or by budget time, if we were able to get on that right away, but it will be really tight.
Okay. No need for closed session?
No, sir.
Motion for adjournment?
So moved.
All gone. Thank you.